Imagine this. You're enjoying your morning coffee, reading the paper, and feeling fine. But deep inside your body, changes are happening that could lead to a life-altering stroke, and you wouldn't even know it. Every year, over 12 million people worldwide suffer a stroke, according to the World Stroke Organization, and many of them never saw it coming. What's even scarier? Some of the warning signs are so subtle, they're easy to ignore. Today, we're uncovering the top 6 silent signs that raise stroke risk in seniors. And if you're over 50 or love someone who is, you'll want to watch this to the end because one of these signs is often mistaken for something harmless, yet it can double your stroke risk. And before we start, if staying healthy, strong, and independent matters to you, hit that subscribe button and turn on notifications because we're here every week with practical, science-backed tips you can trust. We often think of a stroke as something that happens suddenly. Face drooping, slurred speech, weakness in an arm or leg. And yes, those are the emergency signs we're told to watch for. But there's another category, the quiet signs, the ones that can show up weeks, months, or even years before. These signals are often overlooked because they seem unrelated or because they don't cause pain. But ignoring them could mean missing your chance to act early. I've drawn on research from neurologists like Dr. Ralph Sacco, past president of the American Heart Association, and authors like Dr. David Perlmutter, who have been vocal about how lifestyle and early detection can dramatically reduce stroke risk. We'll not only go over the signs, we'll talk about what you can do about them. Sign number 1, sudden episodes of vision problems. Have you ever had a moment where your vision suddenly blurred, dimmed, or even blacked out in one eye for a few seconds, and then returned to normal? Many people write it off as fatigue, dry eyes, or just getting older. But this can be a condition called amaurosis fugax, often described as a curtain or shadow falling over your vision temporarily. According to Dr. Stephen Greenberg, a neurologist at Harvard Medical School, this can be a sign of a mini stroke, a transient ischemic attack, TIA, caused by a tiny blood clot briefly blocking blood flow to the retina. TIAs often precede a major stroke, sometimes within days. Why this matters? Your eyes are connected directly to your brain through the optic nerve. If blood flow to your eye is compromised, it's a signal that blood flow to your brain could be next. What to do if this happens? Don't wait it out. Even if your vision returns in seconds, call your doctor immediately or go to the ER. Get a carotid artery check. Ultrasound imaging can reveal narrowing that increases stroke risk. Review your blood pressure, cholesterol, and blood sugar. All 3 can damage blood vessels and contribute to clot formation. Real life story. I once spoke with a retired teacher, 68 years old, who had 2 of these vision episodes in 1 week. She thought it was eye strain from reading. Her doctor insisted on a carotid scan, and it revealed an 80% blockage in her right carotid artery. She had surgery within days. That decision likely saved her from a debilitating stroke. As Dr. Michael Mosley, author of The Clever Guts Diet, often reminds us, your body whispers before it screams. Vision disturbances can be one of those whispers. Sign number 2, unexplained dizziness or loss of balance. Dizziness is one of those symptoms that's easy to shrug off. Maybe you stood up too fast, skipped lunch, or didn't drink enough water, but persistent or sudden, unexplained dizziness, especially when paired with trouble walking, coordination problems, or a spinning sensation, could be an early neurological warning. In a study published in The Stroke, researchers found that up to 25% of people admitted to the hospital with dizziness were later diagnosed with a stroke or TIA. The reason? The part of the brain that controls balance, the cerebellum, is highly sensitive to changes in blood flow. A small clot or bleed there can cause subtle balance problems without other obvious stroke signs. How to tell if dizziness might be serious? Does it happen suddenly and intensely without warning? Do you also have nausea, trouble speaking, or vision changes? Does walking feel unsteady or off in a way you can't explain? Neurologist Dr. Amy Lee notes that older adults often attribute balance changes to aging or arthritis. But if it's new, rapid, or unusual, it deserves urgent medical evaluation. Proactive steps. Schedule a vestibular and neurological exam if dizziness is recurrent. Keep your blood pressure stable. Sudden drops or spikes increase risk. Practice fall prevention strategies at home because dizziness, regardless of cause, can lead to injuries that further complicate recovery. Sign number 3, brief episodes of numbness or weakness. Picture this. You're holding your coffee mug and suddenly your hand feels clumsy, weak, or even numb, just for a minute or two. Maybe you blame it on sleeping in an odd position or a pinched nerve. But sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, is one of the most telling early clues of a TIA or impending stroke. Neurologist Dr. Ralph Sacco emphasizes that these episodes are not mini in their importance. They are major warnings. In fact, the American Stroke Association reports that 1 in 3 people who experience a TIA will have a full stroke within a year, and almost half of those occur within just 48 hours. Why this happens? A brief blockage in a brain artery interrupts the nerve signals that control sensation and movement. Even if the blockage clears quickly, the fact that it happened at all means your blood vessels and clotting system are at risk. What to do? Treat it as an emergency. Call 911. Don't wait to see if it passes. Get checked for atrial fibrillation, an irregular heartbeat that can cause clots. Ask your doctor about a brain MRI to check for silent damage you can't feel. Dr. Jill Bolt Taylor, a Harvard-trained neuroanatomist who famously experienced her own stroke at 37, describes in her book, My Stroke of Insight, how weakness and clumsiness on one side were her first clear warning. She stresses that timing is critical. When it comes to stroke, time lost is brain lost. Even if the feeling lasts only seconds, it's your body's way of waving a red flag. Sign number 4. Sudden trouble. Understanding or finding words. You're in the middle of a conversation and suddenly, the right word just won't come. Or maybe you're reading and realize you're not understanding the sentences. We all have moments of forgetfulness, but if it's abrupt, unusual for you, and especially if it happens alongside any other symptoms, this could be a sign of reduced blood flow to the brain's language centers. Speech-language pathologist Dr. Swathi Kiran from Boston University explains that even mild, temporary word-finding difficulties, called transient aphasia, can signal a TIA. In older adults, this is sometimes dismissed as senior moments, but when it's sudden and paired with other subtle signs, it can be a precursor to a larger event. Why it's dangerous? A clot in the left middle cerebral artery, the main vessel supplying the brain's language centers, can cause temporary or permanent loss of speech. Early recognition and treatment can prevent severe disability. Steps to take. If it's sudden, seek emergency care immediately, even if you feel fine minutes later. Ask loved ones to watch for slurred speech, incorrect words, or trouble understanding questions. Keep a log of any such episodes and bring them to your neurologist. Sign number 5, persistent fatigue or mental fog. Most people wouldn't connect feeling unusually tired with stroke risk, but mounting research suggests it can be a quiet, early clue. In a 2017 neurology study, researchers found that chronic fatigue and cognitive slowing in older adults were sometimes linked to silent strokes, small areas of brain damage from blocked blood vessels that don't cause obvious symptoms but accumulate over time. Dr. Vladimir Hachinsky, a leading stroke neurologist, explains that these tiny, unnoticed strokes can damage networks in the brain responsible for processing information and maintaining alertness. The result? You feel mentally dull, easily worn out, and less sharp than usual. What to watch for? Fatigue that's new and not explained by sleep issues, stress, or illness. Trouble focusing on familiar tasks or following conversations. A subtle but persistent slowing of thought or reaction times. Steps to act. Ask your doctor about an MRI to check for white matter changes, a common sign of silent strokes. Manage cardiovascular risk factors aggressively: blood pressure, cholesterol, blood sugar, and smoking cessation. Prioritize aerobic exercise, which improves blood flow to the brain. Quote to remember, as Dr. Sanjay Gupta wrote in Keep Sharp, the brain's decline is not inevitable. It's largely a matter of how well we protect our blood vessels. That protection starts before symptoms feel severe. Sign number 6, sudden, severe headaches without cause. Headaches are common from dehydration, tension, or eye strain, but a sudden intense headache, often described as the worst headache of your life, can be a sign of a brain bleed or aneurysm that could lead to a hemorrhagic stroke. Even milder headaches, if they come on abruptly and without a clear cause, should be taken seriously in older adults, especially if they're accompanied by nausea, dizziness, or vision changes. Dr. Jennifer Frontera, a neurologist at NYU Langone, stresses that older adults sometimes underreport headaches because they think it's part of aging. But any new headache pattern after age 50 warrants medical evaluation. What to do immediately? If sudden and severe, call 911. Don't try to sleep it off. Track onset, duration, and any other symptoms. This helps doctors assess urgency. Avoid self-medicating with painkillers without finding the cause first. Now that you know these 6 silent signs, vision changes, unexplained dizziness, brief weakness, language trouble, mental fog, and sudden headaches, the next step is clear. Never ignore them. Acting early could prevent years of disability and even save your life. I'll leave you with a reminder from stroke survivor and author Christine Lee. The most dangerous words in medicine are, "It's probably nothing." So listen to your body, speak up, and seek care, because prevention starts with awareness. If you find this video helpful, please don't forget to like and leave a comment. It really encourages us and also signals to YouTube that our content is valuable. We create videos like this to help you live a healthier life. A lot of research went into making this video to ensure you get accurate and beneficial information. While we couldn't include every detail in the video, all the research sources are linked in the description below for those who want to explore further.